Hi, my name is Anita Wallace, and I'm chair of the Lymphoedema Support Network, and I'm delighted to introduce you to someone that I've worked with for, scarily, nearly 20 years. Professor Peter Mortimer. He's the LSN's Chief Medical Advisor and leading lymphedema specialist both here in the UK and overseas. So does having lymphedema make you more prone to joint and muscle injury?
Well, this is a good question. I had to think about this one a little bit. I'm sure the answer is yes, but to answer it properly, I had to give this some thought. And of course, if I go back to the basic principle of what the lymphatic system's doing, when you injure a muscle or a joint, there are a lot of inflammatory cells and possibly debris and other toxins and things generated in the vicinity of the injury, be that a joint, arthritis, or a muscle injury. And what the lymph system is important for is actually cleansing that area. So the lymphatic system is very important for cleaning up and removing all the nasty bits that have occurred in the area of the joint injury or the muscle injury. So in principle, if your lymph system locally is not working very well, then a muscle or a joint injury is going to be that much worse. I mean, for one thing, if you take a joint or a muscle, actually, it will swell up more because the lymph system's not taking the fluid away. And swelling actually makes an area that much worse in terms of pain and discomfort. If you take a joint, a swollen joint, the range of movement is not so good. So I think the answer to this is that the lymphedema will make the situation worse. I mean, for example, if we take breast cancer-related lymphedema, shoulder problems are very common in that situation. And I suggest to some extent it's because of the lymphedema around the shoulder that actually will restrict that shoulder movement and probably increase pain. And we know in patients who need knee replacement for arthritis who have lymphedema, the lymphedema causes huge problems there in terms of restriction of movement, risk of infection, and we have to really consider that very strongly when the patient has their knee replacement. But if the knee replacement is successful, and then they can move better, so their lymphedema improves, and it's a win-win situation.
Thank you very much. Thank you.